My name is Gitesh, and I'm the Chief Marketing Officer at Versiti. So we're very excited to share a little bit about who we are and what we do. You may know us formerly from our previous name. We were known as the Blood Center of Wisconsin. A few years ago, we went through a brand transition as we put together capabilities by bringing together blood centers from across the Midwest. We acquired a few clinical trials organizations, along with further building our esoteric diagnostic lab capabilities. So, the reason why we brought all this together and set up this new brand called Versiti was to really bring a singular focus of translating our capabilities towards cell and gene therapy. And so the one focus that we have through all of this is our mission, which is to save lives, and translating the capabilities that we've had in the past and some of the first and the innovation leadership that we've had. We want to bring that into this space. So some of the things that we've done in the past includes being the first in enabling the first bone marrow transplant between non-related recipients. We played an important role from a diagnostic lab perspective in that. In addition, we have launched several innovative diagnostic testing for hemophilia diseases as well as von Willebrand disease. So we're looking to build those kinds of capabilities along with our apheresis experience into this space. So one of the other things that we did recently was with the pandemic, we were one of the first blood centers in the US to collect and distribute convalescent COVID-19 plasma. So that's kind of what sets us apart here. And to go a little bit into the details around who we are as an organization and some of the breadth and scale. So we have these baseball card statistics, as we call them, that kind of give you a perspective on what we bring to this space. So we have a lot of expertise around apheresis, and I think that's probably the most common or foundational experience that translates over into this space. Every year we do over 115,000 different kinds of apheresis procedures. Now these could be collections like collecting platelets, but there's also therapeutic apheresis that we do, photopheresis, and other specialized procedures, including leukopaks, which I'll talk a little bit about, and my colleague Dr. Waxman will also talk about that in a little bit. We do over 600,000 blood donations annually, which makes us the 5th largest blood center in the US. And our footprint is primarily in the Midwest, but we'll talk a little bit about how we're expanding into Austin, Texas area as well. And then, we also have expertise in clinical trials, and we've played a role in supporting over 700 clinical trials, to date, and that continues to grow. Based on the collections that we have, we've distributed over 1.7 million blood products across the US. So we feel like that, again, that knowledge and expertise around donor recruitment, around, following collections through a highly regulated procedure, knowing what those regulations are and how to, leverage that in an effective way. I think those things transit over into providing biomaterials, specifically leukopaks, which is kind of the main reason why our main avenue that we see of how to influence and support the growth in cell and gene therapy. Along the leukopak space, we have a donor base, and 100% of this donor base is HLA typed. This is, again, where our expertise in diagnostic lab translates well into this space. We're also growing our white cell contributor bank significantly. We've seen 150% increase, and we expect that growth to continue into next year and beyond. And one other thing to note that we feel is relevant here also is that through our diagnostic labs, we have a strong presence in the transplant medicine space, and about 10% of all bone marrow transplant procedures across the US are supported through the lab services that we provide. So to continue on a little bit about how these capabilities kind of make us ideally suited to be a leukopak and biomaterial provider, there's really kind of three different aspects that I'd like to add to that. So as a blood collector, we've been doing this for over 75 years. One could argue that blood is the original cell therapy, right? Going back decades, right? That's what it is, and it's continued to be used today without any substitutes. So that, highly regulated environment and the experience of that collection, I think, is something that has made us, ideally suited for providing leukopaks. Second, diagnostic labs. We have over 1,200 partners pretty much across the entire U.S. that we support on a regular basis. So, those capabilities also include infectious disease testing. And so that's something else that we do in-house. Some of the other blood centers outsource or, create a conglomerate to work on it. We're kind of doing that on our own. And I think that capability is something that sets us apart as well. And then clinical trials, we've made some acquisitions in this space, and we really are focused on providing centralized lab services, whether it's kitting, sample logistics, all those things, again, fit in well in managing this whole leukopak process from end to end, from collections to distribution to delivery for research purposes. And so, when you put these capabilities together, we feel that we're, from a leukopak collection and biomaterial distribution, Versiti has unique capabilities, and we'd love to talk to you more about it. At the core of it, we're a nonprofit organization, and so we are mostly motivated by innovation and by saving lives. And so, we'd love to continue the conversation if you're interested in talking more about what we do. But at this point, I'd like to invite my colleague, Dr. Dan Waxman. He's our VP of Transfusion Medicine, to talk a little bit more about our leukopak capabilities.
Okay. Let's see here. Thank you for staying around. I know these last sessions we were trying to think of what kind of things we start giving away to get people in here, food, drink, mimosas. So as Gitesh said, Versiti is this gathering of 4 historic blood centers in the Midwest. It's nice because we're all contiguous, so we kind of all ring around Lake Michigan. We really, when we started getting into leukopaks, I say, okay, how can we leverage what we've been doing? And as Gitesh says, we do a lot of apheresis every year. The donor apheresis, patient apheresis, for those of you who know Provenge therapy with dendrion patients, these are men with metastatic prostate CA, and we collect cells and that are sent off to be made magic bullets for them. And so we do a lot of apheresis. As also he said, in the pandemic, we got into convalescent plasma, which was all based on apheresis collections. Many of these individuals who first started coming for convalescent plasma donations had never been a donor at all, ever. And so this is the first time, just because they had COVID early on and were identified for having antibodies, that we would collect them. So now as we're getting into leukopaks, and we have this location down in Austin, Texas, and for those of you who do some of this, it's a different type of donor. It's someone you're having to educate and then recruit to do, right off the bat, an apheresis procedure. And it's one that's not exactly a short one. Convalescent plasma was easy. 40 minutes, they were in and out. So when we look at what our differences and what we've done with research partners historically and with biomaterials, it was a good area to just glide right into. And since in my foray of being a medical director at blood centers, I spent a 3-year hitch in Dallas, so I have an active Texas medical license. So when it came to opening up a spot in Texas, I was the one to say, okay, I'll be the medical director for that. And so we've set this up, and really, when we look at all the aspects, donor management, that's, the one thing about volunteer donors is you got to get them to come back. And you got to, and with HLA typing of donors, and so that was a natural for us. So when we get into these leukopak donors, it's okay, how do we get them in the door, and then how do we keep them, and then how do we follow through? So here's our reach, and this is pretty much the United States. And when you look at what we do in terms of supporting bone marrow transplant, so our HLA lab is in Milwaukee, Wisconsin. And they do a heck of a job supporting bone marrow transplantation in a number, if you look on this map, a number of sites throughout the country, because they're doing next-gen sequencing, high-resolution typing, and this is a tried and true HLA lab through the years. And so all of our contributors that we sign up to be in our biorepository get HLA typing. We also have an infectious disease testing lab in what used to be my home state of Indianapolis in Indiana. And so in Indianapolis, we have our donor testing lab. So we do all the IDT testing, we do CMV testing, and we're able to do all of this in-house. It's just our labs, we're not outsourcing things. When we take the samples of our contributors, in the screening part, we're getting full HLA typing, IDTs, and CMV. And then we can do other biomarker and other types of screening and testing, because we do have also in Milwaukee a diagnostic testing lab, which covers the rest of the country. I mean, we get samples from all over. I mean, people, when they talk about, working at different universities, say, oh yeah, we send our specialized hematology testing to Milwaukee for your diagnostic testing lab. The other things that we don't really point out here, but we have an umbilical cord bank in Grand Rapids, Michigan, at our site there. That has been going on for several decades in the great state of Michigan, which I now reside. Once again, my third time around, I went there as a kid when I was a camper, and then I went to U of M, go blue, as did Gitesh. And now I'm back again living in southern Michigan. So we have an umbilical cord bank that we have traditionally been all for transplantation, but now we're getting to say, okay, some of these cords are not going to be able to be for transplantation, so we can use them as research cords and getting the proper consenting of those donors. The other thing that we have, and it's something that I inherited in Indianapolis, we have a parathyroid bank. And so this is it's an autologous bank for patients who have hyperparathyroidism, and the head and neck surgeons take out almost all the parathyroids and leave a bit in and send us the tissue for cryostorage, so that in the year afterwards or so, if what is up here fails, we send the tissue back and it's implanted in their forearm so they can have active parathyroid. So we even have a parathyroid bank. All right, and finally, we're doing just on time. So, clinical trial experience. Mark Seaman is newly to us, and he really is working in our clinical trials area. Senatron is a company that started in 1995 for clinical trial support. They are in Austin, and that's how we started our footprint down there. Salus is an IRB that was also started down there that is also part of our organization. And so when we look at all the parts now of Versiti, and Beacon is what we call our contributor area down there, and with Senatron and Salus, we covered the whole scope of what can be for clinical trials and biomaterials. If you just look in terms of things we do, beginning of the pandemic, those fun little nasopharyngeal swabs that they first started out with and having to send away for testing for COVID? Well, the company who was doing the testing needed a place, we need a transport container. Senatron jumped up 7 million containers later during the first part of the pandemic. Same thing in terms of clinical trials. And then just the years of experience that Senatron bringing in, and it was a natural fit. And so now we really feel that our whole portfolio of services, from the donors, the biomaterials, clinical trial support, other esoteric testing, is something that we had to offer, and it's kind of fun at this part of my career. I mean, I'm a clinical pathologist by training. I've been a blood banker in 4 different locations, and so now this is kind of cutting-edge stuff, and it's great attending the presentations this week and hearing different people talking about what they're doing, and now that we can be a part of it. So again, we have, it's kind of a mouthful there, versityclinicaltrials.org, but if you go to that, you can learn all about in terms of what we can do with clinical trial support, biomaterials. Again, we have folks here, Mark Seaman, Gitesh, Sean Toddy, and so they are here if afterwards you want to chat or just get a hold of us. We'll be glad to talk to you and work with you. And so with that, in a minute and seconds to go, I will close.